Thank you, Chair Murray. And again, General Becerra, welcome to the Health Committee. It's always good to see a familiar face from our days working together in the House on the Affordable Care Act. Um, as Chair Murray indicated in her opening statement, the previous administration never put a priority emphasis on public health. They did not work to protect those with pre-existing health conditions. In the midst of the COVID-19 pandemic, the previous administration actually doubled down on their efforts, many different efforts to sabotage our healthcare system, actively seeking to overturn the Affordable Care Act in court. Um, as you know, this particular court case threatens to take away coverage to millions of Americans. People like a constituent of mine, Kirsten from Green Bay, Wisconsin. At 11 days old, she was diagnosed with a serious heart defect, and she was airlifted to Children's Hospital in Milwaukee, Wisconsin, to undergo closed heart surgery. Kirsten is now 24 years old, and because of the Affordable Care Act and the nearly 20 operations that she's undergone, um, she's had coverage. And she wrote to me, all of these procedures are the reason I'm alive today. Healthcare should be a right for all Americans and not a privilege for the few. I couldn't agree more. So I think I wanted to start with two sort of overarching questions before digging down into some more specifics. As HHS Secretary, we have basically to provide greater access, we have to not only repair the damage, but also to build back better with our healthcare system. So I'm asking, what are the key ways in which you would strengthen our healthcare system after the damage that's been done in the previous administration? What would you go after first? And then how would you work to build back better in ensuring even more people have access to affordable, quality healthcare coverage?
Senator, thank you for the question, and great to see you again. And I hope if all goes well, and I am fortunate to be confirmed to once again get to work with you as I did for so many years when we were both in the House and when you went to the Senate. Uh, Let me tell you that I can just take the words of our president himself, because he too has said healthcare should be a right, not a privilege. And that's a great place to start if you have the most powerful person in the world saying that. Secondly, he's, as you mentioned, said that we must build on what we've had with the Affordable Care Act to make it stronger, to provide better quality care at more affordable prices. And two of the things I can tell you right off, one is something that the administration has already moved on, and that is to have an open enrollment period, a special open enrollment period for Americans who've lost their insurance or who never had it. And right now during COVID, this is a worse time to not be insured. So the open enrollment period will give a lot of Americans, millions of Americans, a chance to get covered again. Secondly, as you know, because I know this is important to you and members in the Congress, is we got to deal with this cliff that so many Americans face, that when they're in middle class status, if they happen to get a little too high in their income, and high, it doesn't mean high, just middle class, maybe you got a pay bump after last year, all of a sudden you find that you fall off this cliff when it comes to the tax credits that are made available to you under the Affordable Care Act to help you afford your insurance plan under the market exchanges in the Affordable Care Act. We've got to do something to address that cliff that too many families are facing to make Affordable Care Act a reality for more families. There are any number of things that I know you've worked on that we can look at, but I want to just mention at least those two principal ones, and if you'd like, I can go further.
Thank you for that. I wanted to get into a very specific area of the COVID-19 pandemic, and that's increasing. We know at the start of the pandemic, increasing our ability to test was essential to our ability to track down and slow the spread of the virus. The same is true for funding and tracking variants that we find now emerging. We can't afford to make the same mistakes we did at the early stages where testing was virtually unavailable. I've introduced a bill to assist the CDC with resources and to support its needs to dramatically scale up sequencing of coronavirus mutations. As HHS Secretary, how would you ensure that all of our federal health agencies are working together to do their part and take on the next phase of this pandemic at tracking the emergence of these mutations?
And I know that the time is short to respond, so I'll just say it very quickly. One, we need to coordinate much better, whether it's with the Department of Labor when it comes to people who have insurance through their employer and what happens if they happen to lose their job, whether it's working with the Department of Education when it comes to the issue of how we reopen our schools. We need to just coordinate much better. And I will tell you this, we have to be transparent. We have to use data to drive our decisions. We have to let the American public understand how we do that. And if we do it right, people will have faith that what we're proposing will work. And I look forward to working with you and your colleagues to make sure that we have a partnership with the American people because they believe we know what will work.